Good afternoon, everybody. Thanks for joining today. My name is Deirdre. I'm one of the trainers here at Exon Health. We're going to spend about 30 to 45, probably around 35 minutes to take you through optimising practice performance with surgery insights. Just a little bit of housekeeping first. The call is being recorded today for sharing purposes. And secondly, if you have any questions at all, please do drop them into the chat box or the Q&A at any point during the session, because my colleague Amanda is here and she will endeavour to answer them for you. So any questions into the chat box. And lastly, as we go through the webinar, she will be putting those links in as well for anything that we show you. There will be links put in there for you. Okay, so what is Surgery Insights? So Surgery Insights, it provides integrated data streams which combine publicly available NHS data with live telephony and digital assistant metrics from Exon Health and also from third-party suppliers. Operation intelligence, a month-by-month view to explore relationships between data sets, such as comparing inbound calls with online consultations, and performance tracking, which delivers regular updates on workforce, appointments and NHS app usage, typically reflecting the month-end position within 1 week of the data being available. So the primary value of Surgery Insights really is to help you move from reactive management to data-driven decision making. It allows you to optimise workforce capacity by matching staffing levels directly to patient demand, which helps reduce missed calls and identifies where admin tasks can be shifted to digital channels. Secondly, it provides benchmarking against national standards. You can compare your appointment volumes, DNA rates, consultation trends against national averages, so you can clearly identify whereabouts you stand. Finally, it helps you measure digital production adoption. You can quantify the tangible staff time gained and the number of calls deflected by using tools like our Surgery Assist, Omni Consultation, Surgery Intellect, and the NHS app. I will be talking about these tools after for you. So literally, ultimately, these reports give you the insights that you need to bridge performance gaps and maximise your team's efficiency. As we have said, Surgery Insights acts as a central hub, consolidating your practice data into one unified dashboard. So it really saves you from having to jump between different views to grab the data that you need. It allows you to monitor critical performance areas, including operational demand, workforce capacity, digital adoption. It also helps you assess patient satisfaction and experience while providing clear benchmarks against national standards. By bringing demand, capacity and efficiency metrics into one single view, the dashboard enables you to quickly identify areas for improvement and make data-driven decisions for your practice. After any changes have been made, you'll also be able to see then how clearly well they're working for you and making a difference. Beyond being a central hub, Surgery Insights is an integrated system designed to grow alongside your practice, whether you are using existing Exon Health tools like Omni Consult, Surgery Intellect, or adding features in the future. All your data will automatically flow into a single holistic view, including third-party data where access is granted, obviously. So how do we access insights? If you're a Surgery Connect customer and you have bought Surgery Insights, you can access the dashboard directly in the reports console via the phone bar or the single sign-on page, so however you normally get to your reports. If you're not a Surgery Connect customer, it's accessed via a direct link. So it is for other surgeries that don't have Surgery Connect as well. But I'm guessing today that you're all Surgery Connect customers, I'm presuming. Okay, so let's give you a walkthrough. I'm just going to move on to the live system. So this is Surgery Insights. I just wanted to let you know first what I'm going to be doing. I'll point out to you. We're going to be moving down the left-hand side here for these tabs. We're not going to go into every single one of them, but I'm going to take you into most of them that are of use and explain what they are. You can also, just as you can see here, they replicate down across the bottom, so you can go that way as well. All the reports that I'm going to show you, just to let you know, so I won't say it on every single one, there are different views that you can adopt. Okay, so you can see it in different ways. Okay, I'll show you when we get to an actual report. What we've got here is our welcome page. So we base this on a lot of feedback that we received from the initial rollout of Insights, which is over the last couple of years, and what practices wanted to see on this top level. So as you can see across the top here, these are the benchmarks against the national averages for things like do not attend, DNAs, missed calls, yeah, etc. on here. Anything green means that you have met or exceeded that average, and anything red slightly below. Okay, so you can easily see where you are just by looking at the colour, to be honest. So what this does is it measures monthly balance between phone calls, digital consultations and physical appointments, the percentage of patients registered to your practice here. So you can see there's been a big fall on there over the years. And it also will show you here the percentage of patients registered to the practice with the breakdown of GP patient survey, what everyone loves here. You can see that as well. It's just a snapshot really. And it also here, it will track the clinical and admin staffing levels alongside the patient registrations. FTE, by the way, just means full-time equivalent. Okay, so let's go down to the activity summary. So activity summary, this is a really good visual. It shows your practice's digital transformation. It maps exactly how patients are accessing your service by combining the data from all inbound channels. So for example, if you introduce new technology such as Surgery Assist, the dashboard indicates the go live date with a clear marker, and there'll be a dotted line on here telling you the difference from when you first took that on board. What you'd expect to see if you do take on any of these, which obviously I'm going to be explaining to you what they are, Surgery Assist, etc. What you should probably see here is the orange is the inbound calls, and then when you take on different things to help digitally with answering questions from patients, you'll see these orange lines going down. And up here we have if I hover on here, online consultations, chatbots, NHS app, Omni. Okay, so just the digital help. So you can see the difference on there. So from here, I'm going to take you down to the all-important telephony reports, okay, because this is basically what everybody has. So these are telephony reports. It provides a detailed breakdown of how your practice handles phone traffic, and it's essential really for identifying pain points and understanding how patients navigate around the automated menu. It's also available in your standard telephony reports. It's designed to give you total visibility over your inbound call traffic, whether you're using our automated tools or just standard telephony. Here we can see the inbound calls that have queued and been answered, your abandoned calls and your missed calls. So you'll be able to see immediately that visual there gives you a really good idea of what's happening on the system. Patient callback data. So you can see how your patient callback feature is working. Most surgeries have that now. And you can see how that's working a long time. And you can also see here the wait and time for patients, so the wait and the talk duration, how long people have been talking on the calls. And down here you've also got the menu options, so it just shows you what the take up is on your options on your menu really. And as no surprise here, this one here is for appointments, so the appointments are the ones that are chosen first, which we kind of all knew that would be the case anyway. Right, okay, telephony. Now, just to let you know while we are on here, don't forget across up the top here, it's the NHS standard benchmarks, And here you've got, as I said in the beginning, you've got your different views that you can see this in. Okay, so you can, telephony visuals is the one which just shows you a nice kind of graphs. You can put it into a data table or a menu data table. So you can just change the views that you want to see. And also when you hover on any of these metrics on here, you might not see that because it's quite small, but here you can just focus. It's basically scrolling in on the three dots. If I click on there, I can then here export the data. So if I needed to export any of the data in that one, you just hover and it allows you to do that up there. Okay, right, let us go into the appointments tab. So the appointments dashboard, this offers a detailed analysis of clinical workload by benchmarking your surgery's performance against national NHS standards. It tracks key metrics such as the appointments attendance trends, DNAs, appointment-led times, and the balance of care between GP and the wider team. So you can see on here, this is the appointments with the GP and with other practice staff. You have that ability to see there. DNAs, you can see the DNAs on there. And on here, the general consultations, and you can just see what type of consultations they are on there. So, and obviously it will track it with the national standards. So really the goal is to improve from simply tracking volumes to gaining a deep understanding of what your appointment slots represent. So it enables you better management of clinic time. So it's a very good tool. Right, so from there, we're going to go into the NHS app. This is an interesting one. So the NHS app dashboard, this one shows you an overview of how your patients are interacting with the NHS app. The report is split into 5 key areas. What it does is accessible navigation buttons up here. You've got uptake, so how many people are uptaking, downloading the app. You've got the usage, you've got messaging, so any messaging that they're doing, any jump offs, and a data table. So you can choose to look at these in any of those ways. So we can see how many registrations there are per 1,000 patients in the last months, per month. What percentage of your patients are registered with the NHS app? 75% is the average. And so you can see this is green. It's gone over 75%. And if it was orange, it will be under the 75%. And then also this bottom graph is really interesting. It shows how many people engage in the organ donor register and the uptake of people registering. I didn't even know you could do that on the NHS app, but after learning this, I actually signed up for it, which is really, really cool. So you can see that there immediately. You'll be able to see all of that on there for you. Now I'm going to go to the Surgery Assist tab. So I just wanted to explain what Surgery Assist is, if some of you may not know. Surgery Assist is our NHS approved digital assistant. So it's designed to signpost and educate patients towards appropriate healthcare and also community services. Hopefully that will reduce the demands on GP surgeries, and it is proving to do so, the people who have taken it up, and increasing the usage of the NHS app and online consultation tools. So that is basically what Surgery Assist actually is. So at the top here, we've got the timing tab. So it provides a closer look at the volumes of the chats by days and hours. So you can see it's available 24/7. So you can see if people are using it on a Saturday night at midnight, things like that. So that's really interesting to see. And the AI questions. So down here, we've got the top AI questions. They go from the most, and obviously again, I want to book an appointment, down to meningitis, want to speak to a human, things like that. So you can see the top AI user inputs and also the intent. So what are they actually needing? Appointments, prescriptions, that kind of thing. So that's really good. So this heat map here, this one actually measures the total volume of conversations and the number of saved calls So those that didn't need a call after going into this. So that allows you to see on here how many calls are saved after the SMS is sent, percentage of saved calls. So you can see that on there. And here we've got the output really. So how many of those questions have been answered? How many have not been answered? How many have had a follow-up question? So it's very it's a very good kind of tool on there to show you the assist. And that obviously, if you haven't got assist, you won't see this on your Surgery Insights if you haven't got it. Now, some of you may have already taken up our Surgery Intellect powered by Tortoise AI Scribe trial. It's a 3-month trial. If anyone's interested, you can register. My colleague is putting things into the chat for you, so she will put the links in there how you do that if you are interested in trialing it while it's free. So if you have got that already, then you can see here the Surgery Intellect report. Okay, so we've gone to the Surgery Intellect report. So it's only visible if you're using it. It shows how many intellects have been generated. Here it shows the audio length of those said transcriptions and also the word count. Okay, so it shows you how many words as well that have been transcribed. Okay. That's based on 15% of the audio duration. It displays the volumes of outputs from the scribe, and it also tracks the generation of specific clinical outputs. So the letters that have been generated from it, the medical codes that have been generated, the transcription. So it gives you a really good idea of what's been going on with your Surgery Intellect. Now, the next one I'm going to go through is Omni consultations. So again, I'll just give you a quick heads up what that is. So the Omni consultation forms allow patients to submit medical requests directly to your practice. This information is then compiled into responses, allowing your staff to easily manage the triage workflow. The consultation form data, it can be gathered through 3 ways. A voice agent, where they call in and there's a voice agent asking them questions and they answer. A web form, so you can send a form out which goes onto the web and they can then just fill in that way, or manual entry by staff. So they've called in, they're talking to an actual member of staff and they can then fill it in. So again, this report is only visible if you're using the feature. It provides a high level breakdown of how patients are reaching the surgery. Okay, an estimation of clinical staff time that is saved here. So we can see there how much is saved. It shows volumes of consultations and the method of them as well. So you can track growth. Basically, you can just track any kind of trends or anything like that on here, and it categorizes the clinical urgency. So you can see here how urgent that they have put them down as. You can see that there. And the success, obviously, for the voice agent, 70% of those have been successful. And then here it just shows you who the consultation was for. Are they calling for themselves? Are they calling for someone else? Okay, so it just shows you if it's like a child or something, it would be somebody calling for them. Okay, I'm going to go down to online consultations. So the online consultations, it tracks the number of online requests. So the bar chart up here shows the total volume of digital requests that are received each month. To track, you can track the growth over time. This chart here shows the percentage split of requests between admin, clinical, and any other staff that are doing it. So we've got admin, clinical, and other. Okay, so you'll be able to see there on there. And the line graph here compares your surgery's monthly digital usage rate against the national average. Okay, so you can see there, national average 65, there's our 65, and so on. So you can just go along there and you can see that as well. And that is actually based on a national average trend based on per 1,000 patients. Right, okay, I'm just going to take you into operational efficiency. This tab it's basically a dashboard that provides a data-driven look at how digital tools are reducing the admin burden on your team. So if you think of the other reports as like a magnifying glass looking at specific tools, the operational efficiency tab, this is your wide angled lens. So it's where we bring everything together. So whether you're Surgery Assist, Intellect or Omni consultations, this tab calculates the cumulative impact across your entire product suite. So it shows how many hours that have been saved by using Assist, Intellect, Omni, and the total hours that have been saved by using any of these online tools. So it does show along here as well. You can see that it just shows the growth of the impact over time on the patients using digital tools. Right, okay, so I'm going to go down to our favourite GP patient survey. So the GP patient survey, it's the newest tab really that we've made available. It shows you direct annual feedback from your patients regarding their experiences, including access, quality of care, overall satisfaction with the practice. So it kind of tracks exactly how your patients are attempting to contact you and the outcome of those attempts. And it also monitors the adoption of digital services like test results, viewing and repeat prescriptions, as well as pharmacy usage. So basically take a look at this slide and it does actually speak for itself. You can see the pharmacy down there. Your last contact with the surgery, how do you feel about it? Your overall experience, your GP services on there. So you can see exactly percentage-wise how well you're doing on that. Now, the final, you'll be glad to know the final tab that I'm going to show you is the resources. So the resources tab, it just shows where all the data comes from. And if you're interested, you got your contact surgery connect Exxon Health here. You got it shows really transparency of the freshness of the data that's being viewed, the audit trail, the mapping. You can go into any of those, and there we are. Now, just to let you know, if any of you are interested in anything at all that we've been talking about today, please do feel free at any stage to just ask us for more help. There are links or you can contact us at any time. This is basically just a little bit of feedback to show you from Sarah, who's the operations development manager at Western Grove Partnership. They've got this and all of the features that I've spoken about today, and that's just basically her feedback on there. Just before we do finish, just to let you know, if any of you do use our academy, or even if you don't, we've relaunched a new academy. It's our learning field. It's, again, my colleague Amanda there will put the links into the chat for you, but it is basically where you can go and you can complement your knowledge on our system. You can accrue CPD points, you can get certificates, and if you are a supervisor, somebody with supervisor access, you can actually see your own staff and what they've done on the academy. So if you want a new starter, it's good for new starters. If they go on there, you can say work your way through that, and if you need any help, that kind of thing. So it's really quite a useful tool on there as well. So that brings us to the end of the webinar, slightly for 4 minutes. I know it said 45 minutes, but they were just allowing for a little bit of extra time there, but we've luckily gained some of that time back. Anything else that you need will be put into the chat. If you want any help about anything, you can also reach out to your dedicated customer success advisor. And again, all the links and the emails have been put into the chat for you. So on that note, I'm going to say goodbye to you. Thank you all very much for joining. And we look forward to maybe seeing you back in September. August, we don't have any webinars, but back in September, we'll be running webinars to be advised on what on at the moment. But hopefully you'll see notifications of them coming up. So thank you very much and goodbye.